Hello everyone, thank you for joining today's webinar titled COVID-19 the Privacy Line. My name is Akinkumi Akinwumi. I'm the author of the Nigerian Internet Law. Today we will discuss
COVID-19 information, privacy rights, COVID-19 and privacy issues. Is the right to privacy absolute or restricted? Is the right to privacy applicable to the COVID-19 outbreak? Is there any criminal liability for non-disclosure of personal information? Okay, audio is fine. Thank you. Okay. Is there any criminal liability for non-disclosure of personal information? And we also look at references and promo sales of my book, and I will take questions. All right, so I said earlier that we all know that COVID-19 originated from China, and globally as of 7th April, over 1 million coronavirus cases have been reported. More than 295,000 people have recovered. More than 78,000 deaths have been recorded. And we all know that COVID-19 is currently having a deleterious impact on the global economy, countries, businesses, families, entertainment, and has resulted in job losses, that's widened the unemployment gap. And I mentioned that in the US, more than 6 million people have informed the government that they've lost their job. That's widened the poverty gap, especially in a developing country like Nigeria. And as we all know, about 2 weeks ago, the federal government issued a COVID-19 regulation, pursuant to the Quarantine Act. Now, in Nigeria, as of 6th April, 238 cases have been confirmed, 35 people discharged, and 5 deaths recorded. All right. So, but the issue we're discussing here today is not to look at what COVID-19 is and all of those, but to talk about how privacy rights connect or relate to. It's talk about how privacy rights relate to COVID-19. Okay. Now, the Black's Law Dictionary defines privacy as the right. It defines privacy as the condition or state of being free from public attention or intrusion into or interference with one's acts or decisions. That's what the Black's Law Dictionary has defined it. And privacy simply means that you protect or prevent your information from getting to the public. And privacy is one of the human rights, okay? It has been recognized by conventions. Specifically, Article 12 of the Universal Declaration on Human Rights, 1948, recognized the right to privacy. Section 37 of the 1990. Section 37 of the 1999 Constitution of the Federal Republic of Nigeria, as amended, as well as the 4th Amendment of the US Constitution, recognize the right to privacy. Okay, the rights of patients to the privacy of their information as well as their health status, okay, as well as their health status is enshrined in Section 26 of the National Health Act. Okay, now there are regional conventions that also talk about privacy, like Article 8 of the European Convention on Human Rights, and we have the various regional regulations like the GDPR and the NDPR. Okay, but here when we talk about privacy, the concern here is in respect of the issues, the privacy issues that arise or that we can see now raising its head in the COVID-19 era. One of which is the government surveillance, all right? In China, for example, the government has installed CCTVs at the doorstep of people who are supposed to be under the 14-day self-isolation. In Singapore, the government has an app. The government has an app known as the Trace Together app, which they connect to people's cell phones using their Bluetooth in order to identify people that have coronavirus and those that they've contacted in the process. And the same can be said of Hong Kong and South Korea. Now, we cannot we shouldn't misconstrue the genuine intention of the government of these countries, because the main intention of the government of this government, or the government of these various countries, is to ensure that COVID-19 does not spread, is to contain it, is to ensure that the people who have such virus can be traced, can be treated, and others will not be infected with it. But the issue about government surveillance is what will happen post COVID-19 era. Will things return to normal, or will the government just stick to its surveillance? All right. I mean, take, for example, a country like South Korea, where the country is using geolocation and CCTV to track down people with COVID-19. What will happen after the COVID-19 era? That's a major issue in respect of government surveillance. Now, we also look at this, also the issue of data collection and sharing. Recently, it was reported that the US government is in active talks with Facebook and Google to use the location data, okay, of their platform users in order to identify COVID-19 carriers. In China, digital barcodes have been installed on products in order to highlight the health status of individuals. In Nigeria, we all know that the government used the airplane flight manifest to track coronavirus carriers. And globally, countries are now using the location data or geolocation of the mobile phones of their citizens to track coronavirus carriers. Now, the major issue with this data collection and sharing, especially between Facebook and Google with the US government, is the position of the GDPR. Okay, we all know that the GDPR applies not only to the EU, but also applies to countries that collect data of EU citizens. Okay, it applies to countries that have operations in the EU, and countries, it applies to data controllers. I beg your pardon. It applies to data controllers, which in this case are ISPs, internet service providers that collect data of EU citizens, okay, EU citizens that are in EU, or EU citizens that are not based in EU but are based in other countries. Now, a major issue here is how will the EU Council treat the issue that arises from the collection of its citizens' data by the US government from Facebook and Google in the light of the GDPR, okay? And even in Nigeria, we have the NDPR, so the Nigerian Data Protection Regulation. So the major question that arises from that is also similar to the GDPR, okay? Will things return back to normal? How will the regulators deal with collection of data of users by the government for purpose of tracking down COVID-19 carriers and things like that? Now, the third issue is confidentiality of a person's health information. Now, by Section 26(1), as I had mentioned earlier, by Section 26(1), by Section 26(1) of the National Health Act, a person's information, including his health status, is confidential. So that means that a patient may choose not to share his personal information with anybody, okay? He may choose not to share his personal information, including his health status, with health workers and his employers and things like that. Now, but the issue that arises here is, can a health worker compel a person to disclose his health status or his travel history and any other information? Because it's been in the news for some time now that people that return to Nigeria from Europe or from China have not been providing their travel history. Okay, they've not been disclosing this, and only for the health workers to discover this information when the patient suddenly tests positive for COVID-19. Okay, another issue is an employee bound to disclose his health status to his employer. Okay, is an employee who just returned from Europe or who just returned from China or UK, is he bound to disclose his health status to his employer in the light of COVID-19? Should an employee's temperature be checked with medical apparatus by the employer before accessing the workplace? An example of this is when you go to a company, for example, you find the security guards at the gate, and they bring out a medical apparatus to check the body temperature of the employees or the customers of the company. So it's an issue. Now, if an employer or a company realizes that its employee or a customer's temperature is above the level it's supposed to be, can the employer or can the company disclose such information to NCDC? NCDC here means the Nigeria Center for Disease Control. Okay, can the employer do that? Now we're going to address some of these issues shortly. Now another issue, another potent privacy issue, which I have noted, is the disclosure of a person's medical record by a health worker or an employer. Okay, can a health worker disclose a person's COVID-19 test result on social media or to any other person? Okay, can he do this? In the same vein, can an employer disclose his employee's health status to the Nigeria Center for Disease Control? Now, as I mentioned earlier, Section 26(1) says that a person, or we can say here that a patient, already he has the right to keep his information confidential. In other words, he may choose not to disclose such information because his information, including his medical or health status, is private and is confidential to him. But when we look at Section 26(2), it says that subject to Section 27, no person may disclose any information contemplated in subsection 1 unless the user consents to that disclosure in writing. That is, the patient must have consent to that disclosure in writing, or a court order or any law requires that disclosure. And in the case of a minor, with the request of his parent. And in the case of a person who is otherwise unable to grant consent upon the request of a guardian or representative. Now, the C there, which is very important here, says that no person may disclose any information contemplated in subsection 1 unless non-disclosure of the information represents a serious threat to public health. Okay, so it says there again that no person may disclose any information contemplated in subsection 1 unless non-disclosure of the information represents a serious threat to public health. So this provision then raises the issue or suggests that a health worker or anybody who has custody or who is aware or has information about a person's health status can disclose such information where it is a threat to public health. All right. So, which then suggests also that a health worker who has information about a patient can disclose such information for purpose of public health. Okay. Now let's look at the issue of whether the right to privacy is absolute or restricted. Now, we mentioned earlier that the right to privacy is an inherent right of everyone, and it has been recognized by the Nigerian Constitution, Section 37, specifically the the Fourth Amendment to the U.S. Constitution, the Universal Declaration on Human Rights, and some other regulations like that. Now, what we can note here in answering this question is contained in both Section 26, subsection 2, paragraph C of the NHA, and Section 27 of the National Health Act. All right. So it says that I read section 26(2)(c) earlier, but I will repeat it again. Okay, it says, subject to section 27, no person may disclose any information contemplated in subsection 1 unless non-disclosure of the information represents a serious threat to public health. Section 27 then asks that a health worker, Section 27 then adds that a health worker or any healthcare provider that has access to the health records of a user may disclose such personal information to any other person, okay, to any other person, healthcare provider, or health establishment as is necessary for any legitimate purpose within the ordinary course and scope of his or her duties where such access or disclosure is in the interest of the user. So when we read section 26 and 27 together, it gives us the impression or suggests or states summarily that a healthcare worker can disclose the information of a person, can disclose the information of a patient or a person to any other person. Okay, so it says here to any other person. To any other person here is not defined by the National Health Act. So that means that it could be another agency of government, or it could be it could be disclosed to any other person, insofar as it is for a legitimate purpose, and so is disclosing such information within the ordinary course and scope of his or her duties. So that means that the NCDC can come on social media, or its representative can come online to disclose information, such information, because it is for a legitimate purpose of what? Of securing public health, okay? Because we have to read section 26 and section 26(2) and C, section 26(2) paragraph C together with section 27. Now, here comes the big one. Section 45(1) says nothing in section 37. It also mentions some other sections, but in relation to what we are talking about in section 37, it says that nothing in section 37 of this Constitution shall invalidate any law that is reasonably justifiable, okay, in a democratic society in the interest of defense, public health, public order, public morality, or public safety. So public safety and public health there are in italics, or for the purpose of protecting the rights and freedom or other persons. So that means that section 45(1) then gives, or we can deduce from section 45(1) that the provisions of section 26(2)(c) and section 27 of the NHA are both valid and cannot be invalidated by section 37, because that's what section 45(1) says. So it then means that the right to privacy is not absolute. The right to privacy is restricted. I'll take that again. The right to privacy is not absolute. The right to privacy is restricted. So in my own opinion, therefore, I have stated here in this slide that public health and safety trumps our individual right to privacy. It therefore means that a patient or a person cannot insist on his right to privacy in the light of public health. Therefore, where public health and public safety is at stake, then our individual right to privacy will have to take the back seat. Okay, so because public health and safety trumps our individual right to privacy, and that is rightly supported with the provision of section 26(2)(c), section 27 and section 27 of the National Health Act, as well as the section 45 subsection 1 of the Nigerian Constitution. All right, so if that's the case, is there any criminal liability for non-disclosure of personal information or health status? Now, when we follow the how we've progressed in this seminar, we started out with section 26(1) of the National Health Act, which says that a person or a patient has the right to privacy of his information and health status. We then moved on and said Section 26(2) and Section 27 empowers a health worker to disclose a person's health information, including to disclose a person or a patient's health information, where public health is at stake. And then Section 45(1) corroborates that. But is there any criminal liability for a person when he refuses to disclose his personal information? I mean, we've heard that people go to the hospital and they refuse to disclose their travel history, only for the test to show that only for them to test positive for COVID-19, and then the healthcare worker now needs to isolate, and other patients also need to be informed, and it puts so many people at risk. So is there any liability for that? Now, the position or my own opinion is that neither the National Health Act nor does the Constitution nor does our criminal laws expressly provide for such criminal liability. But when we read together Section 45(1), okay, because Section 25(1), because if somebody, the implication of Section 45(1) is that if somebody insists on his right to privacy, insisting on his right to privacy when public health and public safety is at stake, then that will be in contravention of Section 45(1). Okay, now when we look at certain interpretations under the criminal code, Section 1 defines grievous harm as any harm which amounts to a mayhem or dangerous harm as defined in this section, or which seriously or permanently injures health, or which is likely to injure health, or which extends to permanent disfigurement or to any permanent or serious injury, any external or internal organs, member or sense. Now, it defines harm as any bodily hurt, disease, or disorder, whether permanent or temporary. It then goes on to define killing. And it says that killing is when a person causes another person's death rather, directly or indirectly. And it also states that a person is deemed, in Section 314 now, a person is deemed to have killed another if the death of that other person does not take place within a year and a day of the cause of the death. Okay, if the death of that person, if the death of that other person does not take place. Okay, now Section 317 then says a person who unlawfully kills another in such circumstances as to not constitute murder is guilty of manslaughter. Now, what we can deduce from this provision really is, then it also shows, it raises the moot point of whether from all this provision, we can then say that a person who withheld his personal information can be deemed to have committed a crime, or can be deemed to being charged or for manslaughter. In other words, can you charge such a person for manslaughter, knowing that his failure to disclose his travel history and health status caused grievous bodily harm, or harm to the healthcare worker or to other people? Now, this remains a moot point for the court to decide, but that's my own consideration of that issue. I will take few questions now, but I also, before we move on to take questions, I want to say that my book, The Nigerian Internet Law, it's on promo sale. So if you purchase from now till the end of April, you'll be getting a 20% discount on the sale of the book. The discount applies within Nigeria and does not apply to Amazon purchasers. In case you want to purchase on Amazon, it only applies if you're purchasing via the WhatsApp number or the email or from our website. Okay, so I'll take questions. I'll take questions now. If we have any question, please, you can just type your question and send it to me in a chat, or I'll just unmute. I think it's better we can just send it in a chat, and then I will take our question. Okay, this session will end in 5 minutes. So if we can send in our questions, if there's anything we want to add to this, then we could just go ahead. All right. Because when we also look at, while we're waiting for the question, when we also consider the issue of criminal liability, I mean, the healthcare workers they also are family members, okay? Yes, yes, you'll be getting the presentation slide. So the presentation slide will be uploaded on, our firm's website, and you can download it from there. Or alternatively, one of my colleagues can send it to your emails. If you send it in an email to, TNIL at Paragon Advisors, or if you send it to this phone number, all right? Because the health and the well-being of the healthcare workers is also important. So should an healthcare worker jeopardize his life or her life because he or she is trying to treat a COVID-19 patient? So summary, what it is that one of the major takeaways from here is that the public health and public safety trumps our individual right to privacy. Okay, a question here quickly. What about, so there's a question here. It says, what about a situation where a news agency uses a patient's picture to create sensitization on the pandemic like COVID-19? Will that amount to a right to a breach of privacy right? Now, thank you for that question. Now, when it comes to issue of privacy, now there's what we call newsworthiness. Okay, there's what we call newsworthiness and appropriation. Okay, newsworthiness simply means that a story or a fact needs to be brought to the attention of the general public. That is, the public needs to know about it. Okay. Now, the appropriation means that when a person's picture is used in respect of a story to which he or she does not know about. But one of the defenses or the ways that the press have always been able to maneuver the issue of being sued for misappropriation. Misappropriation here doesn't mean fund, but appropriation is an aspect of privacy law. So, but misappropriation is when they are being sued for appropriating a person's picture that is not connected with a news to that news. What can be relied on by the press is to say that that person was at the place where the event took place, or that person is at the place where the event took place. In other words, if you attended a party and you took a picture along with the governor of Lagos State and all, because you are at that event, they can use that picture in order to depict the storyline. But in respect of using a person's picture to sensitize, the press cannot outrightly do that. The press cannot outrightly do that. One, especially in the case where the person has not been declared to have to be infected with COVID-19, or two, where they've not sought the person's permission. Now, if we look at the exception under Section 27 and Section 45(1), it only applies where public health is at stake, and those exceptions apply to healthcare workers and not to the press itself. So, in respect of a patient whose picture is being used to depict COVID-19, that would be a breach of the person's privacy right. Okay, is there another question? We have about 2 or 3 minutes before this goes off. All right, so thank you for that question. So I want to announce the winners of my book. I had said that attendees will get a copy of my book. So based on interaction, I have a winner, and that goes to the person who just asked the question. It says Zictin Gambo. So Zictin Gambo, please just send your details, your address to this phone number via WhatsApp, or to this email, and my team will get in touch with you. I hope it's worthwhile. I hope we've gained something from it. I hope it's worthwhile. I hope we enjoyed it and it's worth the time we've put into it. Did we learn anything from it? Can I say a quick comment? Did we learn anything from it in respect of privacy, in respect of the restriction on the right to privacy when public health is at stake? All right, thank you. Thank you so much for joining this webinar. Yeah, thank you so much, Temitola, for your comments. Thank you everybody for joining this webinar. If you send your email to this phone number, the slide will be shared with you, or if you send an email to tnil@paragonadvisors.com.ng, the slide will be shared with you, or you can also get it from our website. It's going to be uploaded on our website soon. Thank you so much. Stay safe, stay at home, stay safe, don't be afraid, and remain positive. What else can I say? And keep doing good. This is just a phase, and we will overcome it. The human race will overcome it. All right. Thank you so much for joining this webinar session. Thank you. Bye for now.